Welcome to this fourth quarter Q&A with Inify Laboratories CEO Fredrik Palm and Product Manager Christian Eurén. I am Ole Eikeland. Fredrik, the expansion in the UK is making good progress. You've gained access to your laboratory at Milton Park. What are the key milestones remaining before you are fully operational?
I agree, it's progressing well. Now we are in the process of installing and verify our complete system in the laboratory, and it should be completed within short. In addition to that, we have applied for necessary permits to commence clinical routine diagnostics, and we are waiting for the approval from the UK authorities.
Okay, on the marketing side, how are the talks with the UK public health system, the NHS, going?
It is progressing well. There is a strong awareness in the UK about the challenges they are facing to meet the ambitious targets they have in diagnostics and patient pathways. And we are experiencing a clear interest in our services that are addressing all those challenges in a very sustainable way.
What concrete signs give you confidence that the UK market will open up for you?
Our significant investments in Inify in the country, combined with the factors just mentioned, I'm confident that we will be an important partner to improve patient pathways in the country.
How does Inify's workflow differ from more traditional pathology setups?
Yeah, so we have built the lab as a system for high volume diagnosis, where we don't have any queues. Every sample is automatically processed through the whole system. Very efficient.
One of the key issues in this field is long waiting times, sometimes months. Why is gastrointestinal pathology affected by delays?
I think the reason is that in healthcare today, the focus is always cancer. That's always the high priority samples. So in gastrointestinal diseases, there's a lot of non-cancer questions, and they tend to be low priority.
Inify is offering guaranteed response times of only a couple of weeks. Operationally, what needs to be in place to deliver that consistently?
The system is already in place and up and running. We started in small scale in September, and it's working really smooth.
You describe customer feedback as very positive. What are customers responding strongly to?
I would say, first of all, the fast response time. So to have a guaranteed answer in 10 days means that they can schedule the follow-up with the patient already when they do the examination. Then they also appreciate the very user-friendly interface where they put the request. It's very easy to work with. And also the report is very clear, structured, always made in the same way. So there's no need for interpret a long story from a pathologist.
I think the development of the system in itself has taken the user into account in a very, very heavy way, and that's why we see this result.
I think important when we talk about users, we mean everyone involved in the system. So starting with the endoscopists, the lab technicians, the pathologists, and the patients. And we really consider all aspects of it.
With screening programs expected to increase diagnostic demand, how prepared are you to handle significantly larger volumes?
The whole lab is built as a system, and all the processes are already in place. So it's just to add more staff and more instruments, but the process is already in place. So it's easy to scale up.
Market activities are ongoing in Sweden, and you expect volumes and sales to gradually increase. What will determine the pace of that growth?
We have a fairly large private market, at least in the Stockholm area, and that we expect to be able to penetrate quite quickly. Then we have the public market, the public sector, which is a little bit slower due to regulations, public tenders, and stuff like that. So that will take a little bit longer for us, but we are very confident that we will reach it.
Fredrik, you reported strong growth year on year in the fourth quarter. What are the drivers behind that growth?
If I was to pick one, it is that we continuously deliver significant improvements for our customers in efficiency and quality in a sustainable way. and that has started to resonate. Sales processes are lengthy and complex, but every customer generates sustainable recurring revenue.
The 100 million Norwegian kroner share issue was guaranteed by the largest shareholders. What does that say about investor confidence, and how far does this funding take you?
We see it as a solid proof of trust in the business strategy, as well as in us as a team to establish this business. It gives us the financial stability and endurance in complex, lengthy sales processes. We aim to reach profitability within this existing group with this capital injection. However, it also always depends on strategic decisions made by the board, for instance, within expansion pace.
When we speak again in a year's time, what milestones would define success for you and Inify?
Market penetration with NHS trusts in the UK, overall sales increase with prostate cancer diagnostics, as well as gradually growing sales within gastrointestinal diagnostics in Sweden, where we are in the market entrance phase. That's the milestones I foresee in 2026.
Fredrik, Christian, thank you.